So you've been having pain on your lateral elbow and it's really affecting your workouts. We can't grip well, we can't do pull-ups, anything with a dumbbell, barbell, really aggravating the lateral aspect of the elbow. And now it may even be carrying over to a simple task of grabbing a cup or a water bottle. That's a problem. In this video, we're going to be teaching you some simple steps that you can do right away to start fixing that. My name is Dr. Andy Johnson. I'm a physical therapist with AJ Physical Therapy and Performance. Check this video out. Okay guys, before I continue, I want to remind you guys that as much as we enjoy providing this content for you guys that is hopefully helpful, what we enjoy more is getting to work one-on-one with you to create a customized plan to fix the problem. So if you guys are living in the Ottawa or Chattanooga or Cleveland areas, please make sure you reach out. We would love to help you out with your musculoskeletal problem, get you back to doing what you love to do most, and that's staying active. So before we go over the exercises that you can be doing to help fix your lateral elbow pain, let's make sure you're a good candidate for this. Now, full disclosure, there's really should be a full examination to really make sure you have what we call lateral epicondylitis. However, there's a quick test you can do to yourself to see if you really fall into that category. And here's the test. It's pretty simple. So if I'm having pain on my left elbow here, I'm going to hold my arm out straight, elbow is straight, fingers out straight. I'm going to take my other hand and I'm going to give a lot of resistance to that middle finger. I'm going to try to hold it so I can't push it down. Now, in doing that, if I have a true lateral epicondylitis, it should recreate my symptoms and pain right here, and it usually doesn't take much. Okay, so if you do that test to yourself and it reproduces your lateral elbow pain, these exercises are for you. Okay, so step one, we want to try to desensitize the area where we're having pain. And in order to do that, we're going to use an implement. Here I've got a lacrosse ball. You can also use a tennis ball, works pretty well depending on how sensitive the area is. So here's what I like to do. We're going to take that ball. The goal is I don't want you to put it directly on pain site. You're really going to drop just barely below that on that muscle tissue. And then we're going to pin it down. I'm using a table. You can use a counter. You can do this on the floor. And I'm going to pin it down, take my other hand and put pressure right on top of where that ball is. And we don't have to be ridiculously aggressive. We're just going to gently press into that ball. I'm moving it slowly back and forth in a very small range of motion, trying to increase blood flow to that area and try to desensitize it a little bit before I do the exercises. We can even move the wrist back and forth, side to side, scrubbing that area just to try to get that tissue to calm down and release a little bit. I recommend spending a solid 90 seconds to 2 minutes desensitizing before you move on to the exercises. Okay, so step two, we're going to work on what we call isometric loading to that muscle tissue. Isometric meaning we're contracting the muscle, but it's not moving. I'm going to utilize a light dumbbell here. I really recommend you guys even start out a little bit lighter than this, especially if you're having a decent amount of pain. Because when you do all of these exercises, I want them relatively pain-free. The goal is not to just drive it through pain, it's to find that range that we can work on it without pain. So what I'm going to do here, we're going to set up. I'm going to be working on the right elbow in this situation. I'm going to prop it on the table, somewhat 90-degree elbow bend. We don't have to be directly underneath you, but have some good elbow bend. And then we're going to take that weight, we're going to hold it out, and I'm literally just going to hold it there in what we call an isometric hold. I may hold it for 8 to 10 seconds. You'll feel this muscle group here around the elbow working. Give it a break, reset, repeat. Again, I want you to keep this relatively pain-free. My suggestion is get at least 8 to 10 reps of that 8 to 10 second holds before moving on. After you're doing this for a few days, if it's still pain-free, you can either start to bump up the weight, or you can also try it with that elbow lengthen. That's going to put a little bit more stress on that system, but don't move on to this unless you're able to do it pain-free with the elbow bent. And then you repeat that process with the elbow straight. Once you make it a few days of no symptoms with that, then you can move on to what we call eccentric loading to that system. So let's go over that. So step 3 is the eccentric loading to the same muscle group at the lateral elbow. The setup is going to be the same as the isometric, except we get to do a little movement here. So I'm going to take the same dumbbell back to my starting position here, weight in the hand, and then what I'm going to do is slowly lower the weight down. That's that eccentric contraction where the muscle is lengthening but contracting. I'll get to end range, and then I'm going to take my other hand, assist it back up, and then repeat. Control slowly over that 8 to 10 second period. When I get to the bottom, pause, assist it back up, repeat. Same process as the isometrics. If you get to over several days, hey, I can do this and it's relatively pain-free, your 2 options are go up and load, but also I suggest doing it with the elbow straight. And again, that's going to put a little bit more stress on that system. I'm going to lower it down slowly, assist it back up, and repeat. Again, I can't stress enough, don't do these exercises just to push through pain. You want to find that range and load and position that you can do it relatively pain-free. If you are doing that, these exercises can really help regenerate that tendon, and it'll slowly improve over time, but don't just push through pain. Okay, so a quick pro tip for you. We consistently find those who come see us with lateral elbow pain tend to have some weakness in what we call shoulder external rotation. It's our ability to do this motion. And so we want to make sure we're strengthening the shoulder external rotators to also facilitate some stability and offload what's happening at the elbow a little bit. So here's just a quick exercise for you. There's a lot of ways to strengthen this. I'm just going to give you a real simple one. You can take a towel, you're going to put it underneath your arm, you're going to take your dumbbell, you're going to lay it on your side, and all we're going to do is you're going to engage those shoulder blades back, pull them back, rotate up, control back down, keep the arm compressed into that towel roll. And that'll really help you strengthen on the back side of the shoulder. Check it out. So a couple things to note: if you want these exercises to be effective in helping your lateral elbow pain, consistency is key. I usually tell people you need to do these at least 3 or 4 days a week consistently over time in order to start to see some positive results in your elbow pain. Now, that being said, it's important to note the average time frame that someone deals with lateral elbow pain is usually 6 to 8 months plus, and that's with a customized treatment plan. It doesn't mean it's always going to last that long, but understand it can be a long road, so we do need to be patient, but consistency is key. A customized treatment plan is your best bet to get back to what you want to be doing as quickly as possible. I hope you guys found this video helpful. If you have any questions or comments, leave it in the comments below. I would love to interact with you. Also, please subscribe to our channel if you haven't already. It allows us to reach out to more people. Lastly, check out the description below. We're going to have some links that you can click on that will hopefully lead you to some more tips to get you back to doing what you love to do most.